Good afternoon. My topic is ganglion cell complex thinning in hypertensive diabetic patients without retinopathy. I aim of the study to study ganglion cell complex thickness in hypertensive diabetic patients without retinopathy. The materials and methods. The study design was a cross-sectional study and setting was Department of Ophthalmology, MES Medical College, and the study population was hypertensive diabetic patients without diabetic retinopathy came in ophthalmology outpatient department. The inclusion criteria, that is hypertensive diabetic patients without retinopathic changes, and I excluded the patients having other ocular diseases like glaucoma, patient with history of previous ocular surgeries, trauma, intraocular injections or laser photocoagulation, and ST-OCT reports with poor signal strength less than 6. The sample size was 96 patients. The methodology, full medical and ophthalmology history, visual acuity using Stenel's chart, intraocular pressure with non-contact tonometry, slit lamp examination, dilated fundus examination, and ganglion cell complex thickness measurement using serous STOC. In OCT macula, the ganglion cell complex, that is GCL plus IPL thickness in 6 sectors including superior, superotemporal, superonasal and inferior, inferotemporal, inferonasal measurement from the elliptical annular center on the fovea. The measurement is below first percentile of the normative database, which is coded red with minimum GCL IPL is considered as GCC thinning in my study. The data analysis, data entered in Microsoft Excel and analyzed by SPSS software. The mean age of the study was 56 years and the sex distribution, out of 96 patients, majority were male and followed by females, around 46%. The GCC thinning, in right eye there was 39 patients showed GCC thinning and in left eye there were 38 patients showed GCC thinning. There are almost equal GCC thinning noted in right and left eye. Then discussion. Diabetic retinopathy is recognized as the leading cause of visual impairment and blindness, and it is primarily considered as a disorder affecting the retinal microvasculature. Histopathological and OCT based studies showed apoptosis of retinal ganglion cells, reduced synaptic activity and thinning of inner retinal layers even before retinopathy changes occurs. Ganglion cell complex is vulnerable to metabolic stress, chronic hyperglycemia and impaired neurovascularity. The present study reinforces this concept by demonstrating measurable GCC thinning in patients who still have normal fundus on examination. Hypertension appears to exacerbate this process by accelerate neuronal damage through oxidative stress, endothelial dysfunction and impaired retinal perfusion. Conclusion. The present study observed the average age of participant was 56 years. Both the right and left eyes of patients demonstrated a comparable extent of GCC thinning in hypertensive diabetic patients who did not exhibit signs of retinopathy. A significant correlation also identified between degree of GCC thinning with aging. This research offers important insight for individuals with diabetes and hypertension by allowing for the evaluation of GCC thinning, which can enhance patient monitoring practices. The use of SDOCT is anticipated to serve as an effective method for detecting early neurodegenerative changes even before the onset of diabetic retinopathy. The result emphasized the value of incorporating OCT-based GCC analysis into routine evaluation of high-risk diabetic patients. Early identification of neurological alteration provide a critical window for timely systemic optimization and closer ophthalmic surveillance, hence enable more proactive management to preserve long-term visual function. These are my references. Thank you.
How did you find out that reduced synaptic activity, OCT you're told, reduced synaptic activity? So physiology is going on. How do you know that transmission is not there? How do you know that?
That is based on previous studies of histological and findings, sir. Reduced
We
system.
are given one inference, synaptic activity is reduced. Then how did you know that synaptic activity is reduced? Because these type of small things, we'll ask in exams. You have to be prepared yourself. Understand?
When you are structuring a study, when you are looking at ganglion cell thinning in diabetic and hypertensive patients without retinopathy, that is your point. Immediately your mind should think whether if the thinning is happening, whether any dysfunction is also happening. That is an immediate corollary, no? Isn't it? So then you'll have to structure something which will test the function also. Or else you will not be able to argue. That is why Dr. VRB is pointing out, if you are saying just an anatomical thinning, it will not have any value unless you corroborate it with some dysfunction. And that, if you have done it, it would have looked a very good study, because all diabetics and hypertensives, we are constantly evaluating them, so we can easily do an ST-OCT on them, and GCC can be picked up. But how much of relevance it will have, how much of inference you make out of that finding is important. The study is not bringing out that. It's just trying to see if you have done like, if the study is like the outer nuclear layer thinning in case of diabetes and hypertension, it would have been same. It wouldn't have been any different from GCC thinning, because you are not getting any functional inference out of it.